Yeah. All right. Good evening. Welcome to the iHealth channel and then on iHealth Radio, Hurricane H in the house. And I have a few guests with me today. I have the special team from Centers Plan for Healthy Living that will be discussing a very special topic, which is ideal and typical for the month of October, and many people may not know about. So let's briefly discuss what that is. So we all know in the month of October for multiple things, one being Halloween month, right? Everybody's like, typically, decorates, does their thing and all that good stuff. It's also in the healthcare, it's also breast cancer awareness month. But what is also known in the insurance and the managed care and the senior world, as well as in the healthcare, it is also the month where the annual election period for Medicare enrollment, which is basically where everybody has an opportunity to, select a health plan, join a health plan, move from a health plan. And so today is the October 15th, and today marks the beginning of the 2021 season for the enrollment in the Medicare space. But we're going to talk a little bit about the overall Medicare program, and that's we have the experts, and from there we'll talk a little bit more about what it means, for this particular season and what it means for the seniors and for the agents, for the industry. So the first thing I'm going to talk about is really just the general Medicare. Now, we all hear Medicare. Some of us may know what Medicare is. Some of us may not know what Medicare might be. We will be starting with that. But before we do that, I'm going to introduce my team here and my guests, special guests. So I have Glennie Espinal, I have
Hi,
Tiffany
guys.
Wong, I have Laura Seefeld, and we have Vladimir Robu, all from Centers Plan for Healthy Living, which is an HMO, a managed care organization in New York that actually promotes different health products and specifically health plan products in the health maintenance organization space. And I know I've talked about these things in previous shows where we had to talk about, MCO world. Today is a series of the senior world or senior health type of talk show. And we will actually touch in all these little topics, slowly but surely. We do have about, I would say about 30 minutes for the show. And so it will be a brief show. We're not going to put a lot of information, but if you're watching the show today, it will be just great to get some of the basics and understanding what the options and the choices that someone might have here. So whether you're a consumer, you're an actual professional, or you're a caregiver, this is going to be a nice session. You can get some feedback and some information that you can use, to make some decision in the next few months if you know someone or you personally have Medicare option that you need to select from. So that being said, Tiffany, how are you?
Good. How are you?
All right. Well, welcome to the show.
Thank you. Thank you. Great to be here.
All right. Well, the head iHealth channel, is very pleased to have you on and the whole team here. So we're going to talk about Medicare in general first, right? So let's talk about Medicare. Um, Tell us a little bit, but how do you see Medicare? Let's define what Medicare is.
Okay. So, pretty much Medicare is, a federal health insurance basically that's available to all of our US citizens, obviously. So, it's a federal administered program. So, a lot of the funds come from the federal government. So, anyone that is a US citizen that's worked here for about 10 years or the 40 quarters, they're entitled to Medicare. So it's a health insurance that breaks out, and it's very structured. So it has like four different parts where it offers you, part A, which is your inpatient hospital insurance, your part B, which is your outpatient. So it really covers you for all your doctor services, um, DME equipment, and just anything that's outpatient. And then you have your Part C plans, which is us, Centers Plan for Healthy Living. So it's a really exciting time right now for Centers Plan for Healthy Living because, obviously it's AEP season, but also in the direction of our company where it's going on and our focus on really on these Part C plans. which we'll get into in a little bit, but pretty much it's all our Medicare Advantage plans. And then, of course, Part D, which is our prescription drug coverage as well. So they're also entitled to that particular benefit too. So pretty much all Medicare recipients and beneficiaries, once they are eligible for Medicare, you pretty much get to select, what parts you want. Whether that's Part A, Part B, Part D, or you get to go into a Part C plan, which is, what the people normally want because of the enhancements and all these supplemental additional benefits that you are basically benefiting from. Pretty much original Medicare has that structure and what they offer. It's pretty much straightforward. There's pretty much everybody's entitled to the same set of benefits. But what makes it unique is really the Part C plans and having that ability as a consumer to be able to shop around and be able to pick the perfect plan that really works for that prospect, for that consumer. So everyone has, different tastes, different benefits that they're looking for. Different features that they're looking for that fit best for their healthcare. So pretty much that's what, the Part C plans are.
All right. So
Go ahead.
thank you. And now that's the Medicare in general and the different kind of parts that it comprises with. But now people have options. Ultimately, we talked about today launching being the mark of the new season for annual election, where people can actually select the Part C plan or other option. But so there are other options available to Medicare beneficiaries in addition to the Part C. So I know for a fact. I mean, there's obviously the MedSups, right? So is that something that is a value for someone, for example, that has Medicare? Someone will ask, well, why? Well, I want to go with the Part C plan. Well, I can just, and this actually came up to me not even a week ago. We had a conversation with someone, and that was the question, like, well, I don't want to be in Part C. I want to be on the MedSup, right? That's somewhat is a choice, but not everybody wants to make that choice because, again, these other MedSups, they're insurance policies that you buy in addition to your regular costs.
Costly.
Exactly. So Laura, since you obviously been around, this stuff about the MedSups. Tell us a little bit about that cost. How does that work? How does that also relate to Medicare?
Yeah. So Medicare is going to cover the 80%, right? Yep. You have Medicare Part A for your hospital and Part B for your medical, and it will cover, after you meet your deductible, 80% of the cost. Supplemental is designed to cover the 20%. So you're going to pay in this day and age probably around $315, $318 a month to have the supplemental cover the 20%. It's only going to cover exactly what straight Medicare covers. It'll cover your doctors, your hospital, your medicines, but it's not going to cover any value-added other benefits, which would be the reason that a lot of people do prefer a Part C plan, because it's going to give you things like dental or vision, things that straight Medicare is not going to cover.
So technically, Medicare does not really cover the dental, as you said, the vision, the hearing, right? And so even if you did buy one of those policies to supplement your cost, your out of pocket, it would not give you the additional benefits. And so therefore, you will have to probably pay out of pocket for those things if you needed to go to dentist, for example.
Yeah.
By joining a Part C plan, you'll have the ability to get those additional benefits.
Yeah. And we live in an urban area here. So many people that retire are used to having from their former employers an HMO or a PPO style of coverage, a Part C style of coverage. So when you have a supplemental, it allows you to be able to visit any doctor anywhere in the country that accepts Medicare. But a plan like ours, a Part C plan, is going to offer you universal worldwide coverage. So you're still going to be able to go to an urgent care center or an emergency room if you're traveling out of the States or out of New York or out of the country. I think that provides a better advantage even for people.
So, but primarily we're talking about emergency, right? So if someone, let's say you reside in New York City or New York State and your benefits are administered by a plan here in the state, if you were to move to, let's say on a trip, to Florida, and that's a lot of people do the snowbirding thing, right? And so sometimes that becomes a challenge because they need to have some sort of a transitional coverage there. Some plans may offer this, right? But not every plan does. But for an emergency, specifically, you would go to any ER in the nation and be able to get services. Is that correct?
Or in urgent care and see a doctor at the urgent care.
Well, some plans do. I'm assuming not all the plans will allow for urgent care outside of the state, but certainly the emergency, which basically life-threatening situations, will be qualified. Now, I'm aware of like many plans that do also offer what, as you mentioned, like worldwide emergency coverage. I know Centers does. But certainly that's an option that is very beneficial to people who probably like to travel overseas and visit family. I mean, obviously during these days right now, it's a little tough.
Go on a cruise, You get sick on a cruise, you eat too much, whatever, drink a little too much, got to be shipped off, $25,000 worldwide. That'll cover the helicopter to get you off the cruise ship.
Laura, you mentioned cruising. That's like, I'm actually right now, on a withdrawal with cruises because we can't get on the ship right now. It's a little problem. They just put their own kind of new rules because they're going to start soon. So not the topic for the day, but certainly we can always talk about healthcare on the ship. But yeah, it is obviously our seniors, do love to travel and they have the time to do it. And a lot of them actually prefer cruising as an opportunity. And to your point, sometimes you're going to these islands and something happens, you're stuck. If you're going to go to an emergency room there, you need coverage. So that's as far as the parts, the additional benefits that somebody can get, if they choose not to be on a MedSup policy or a Medigap, and then basically select a Part C plan. Now let's talk quickly on we talked about Part A, outpatient, right? Part B, inpatient rather. So that's the hospital, anything that's done inside home care, that kind of thing, inside the hospital specifically, skilled nursing facility, right? And then we have the outpatient, which is your visit to your doctor, to your specialist, to your ambulatory surgery, that kind of thing. And then we have, the Part D, which is the drugs. So that's a big one. I mean, I know the drugs can be costly, right? So what are we telling people about what's the best way to understand their drug benefits, when they have Medicare? Because remember, some plans, some people will select just to be on what we call a Part D plan, and they're not really involved. They still have their original Medicare. And some people will have some sort of a Part C plan that includes the drugs, right?
Mm-hmm.
So what can we say to folks right now that are listening or watching, the importance of selecting the proper, Part D plan or the proper plan that offers the drugs, and how does that vary, for example, from plan to plan?
So basically, all the plans are going to have the basic same stages. First is a premium, and you could have a premium that could be $0, or you could have a premium that's going to be $100. Mm-hmm. Then you're going to have a deductible that you have to meet. And then once you have met your deductible, then you're in the initial coverage period. And then once you hit, I want to say 4130, is that the right number?
4020.
4020. Once you hit $4,020, then you're in what's called the gap. And this year is a good year within the gap. This year, it's straight 25% for all medicines, whether it be a generic medicine or a brand name medicine. So once you're done with the gap and you hit 6550, and that would be money that you have laid out of your pocket, then you hit the catastrophic. And once you're in catastrophic, you're basically paying $3.70 for generics, or $9.20 for brand names, or 5%, whichever is greater, not whichever is less, whichever is greater. But basically, that's what all the Part D plans have. With our program, with our MAPD, we offer what's called an enhanced drug program, which means that the deductible is less than the Medicare standard. If you have a standard Part D plan, just a PDP, prescription drug program, $445 is the deductible that you'd have to meet, meaning you'd have to lay out that money before the insurance is going to help and start paying for stuff for you. Ours is $395 with our MAPD program, and that's a nice discount. And we don't have a deductible for when you're taking generic medicines. I was going through a lady's drugs, and she had quite a number of medicines, probably like about 10 medicines, but it turned out they were all tier ones. So they break down medicines by tiers. Tier 1 is preferred generic, tier 2 would be a non-preferred generic, tier 3 would be preferred brand, tier 4 would be non-preferred brand, and then the tier 5 drugs would be the catastrophic drugs, the drugs that usually are super duper expensive for very rare kind of conditions. Sometimes in that class, you'll also find a drug that's gone generic, that the patent has expired on the medicine, and now all the different companies can make it. Yeah, it's really nice if you could have all your drugs be tier ones.
That is lucky. I mean, typically, some of the what I call the three stooges, anything for cholesterol, blood pressure and diabetes, those are usually the high-end stuff, and sometimes you don't get them in generic format, which can cost money. So that's great, actually. And congrats to the lady that she was able to get all those for nothing. No cost.
Right, mail order. Do the mail order, get them for zero.
That's right. So now we're talking for main standard, like, so someone that is straight Medicare and that's it, that's all they have, Medicare, and then they have options, right? What about someone that has the Medicaid side, right? So those are also folks that have options. Medicaid ultimately being, a state-run kind of insurance, funded by state and feds, but, what happens to those folks? I mean, do they have the same, I guess, costs that, we've talked about, or they're varied or different?
So,
do you want me to talk about that, or do you want somebody else to talk about it?
Listen, it's okay. It's not an interview. We're having a discussion. So,
so folks that have Medicaid have basically everything covered for them. So let's say are we talking specifically Medi, right?
Yeah.
So somebody that has their Medicare doesn't cover everything 100%, as we've already stated. They're going to come in and pay 80% of your cost. So what the Medicaid program does is that they come in and they cover that 20%, right? So they'll be able to, you won't have any out-of-pocket costs. So those out-of-pocket costs that you usually incur, whether you're staying original Medicare, they're going to cover that. If you go into a Part C plan, what happens is that now you get those nicer Part C plans with the benefits that are slightly more enhanced, and you get a bigger OTC balance, or you get better co-pays and things like that, depending on the level that you have. So Medicaid gets broken down where you can either have full Medicaid, full benefits because you meet the income requirement, because it is specific to low income individuals. Like that is the criteria to enroll or get Medicaid benefits, right? So let's say you don't meet the criteria, but because due to assets or things like that, you can also be possibly eligible for what we call the Medicare Savings Program. All right, so that's just a different program for people that don't necessarily meet the criteria, but are still some type of low income and need financial assistance. They'll come in, and that gets broken down into 6 different levels. And the MSP program will come in and pay their out-of-pocket costs for Part A and B. And then we have another program, and that one is run by Medicare, not Medicaid, the LIS program, and they'll come in and cover their Part D. And they can have either full or partial LIS. So if they have full LIS, it's essentially like having full Medicaid. Everything is going to be at zero cost. They're not going to have a deductible. They're not going to have a premium. They're not going to have an out-of-pocket cost, no co-pays, things like that. If they do have partial LIS, then they're going to have some type of out-of-pocket cost, but everything is reduced. So instead of having, for example, for our MAPD plan, the deductible is $395.
Mhm.
Instead of paying $395, it can range between $0 to $92. So that is just the perks of being low income, right? Where you'll get this program, they'll come in and pay all those out-of-pocket costs or get the enhanced benefits from a D-SNP plan, which is what we call the Part C plans that offer for dual eligibles.
No, well, that's a lot of information, and I know we know this more or less because we do this on a day-to-day basis. But it does sound like it's a lot, and so a good question to Laura. I mean, how do you really handle putting all that information to your clients, because it is not easy to explain all these details and all these options, because I'm sure you come up across some folks that may qualify for different things or may be eligible but they don't know. So it's pretty hard, right? I mean, what usually
Yeah.
do
I,
to kind of
I
convey
like to
this in
sit
an easy
down
way?
and chat with them about what their income level is, if they're saying that things are too costly for them. You have Epic, the New York State SPAP, which is got an income for an individual single person at $75,000 a year, married couple at $100,000. So when you start talking to people about that kind of level of help, they become more open to sharing their information, and you can assist them. Epic at the lowest levels will give you a slight fee that you'd have to pay to be able to have the program. But at the higher levels, you have a deductible. So if your drug costs are such that you're falling into the donut hole, the coverage gap, it's going to allow you to be able to have that working secondary to your to whatever plan that you have, whatever drug plan you have. And the requirements for Epic are just that you live in New York State and you be 65 years old and that you have a Part D plan. So it's pretty easy to be able to qualify for that. And then if you step down, let's say your income is a little bit less, then you can qualify for that LIS program. And basically, you're going to either have zero copay, you're going to have nominal copays $1.30 or $9.20 for medicines, no matter how expensive they are, if you qualify for the LIS program.
So I just want, sorry, I didn't mean to cut you off, but just want to clarify, because I mean, obviously we're referring to Epic in the New York State program, but certainly there is a similar program in pretty much every state. So whatever you are in the 50 states, you should be able to access a similar program through that particular state. So and we refer to them as state pharmaceutical assistance programs, and they work similarly to what Laura just mentioned. But in New York, that's actually the program that that is more relevant, and the folks that she works with are the ones who kind of benefit from it. So I wanted just to transit to a different item in the discussion, which we started talking about the annual election. So ultimately, different folks have different times of the year where they can do some transactions with Medicare. Today marks the biggest, I guess, season of all. This is like the season of Medicare. So can anyone tell us a little bit more about the different options that folks may have throughout the year, the different restrictions, and why today marks the bigger and the better, time of the year for them? Anyone?
Sure. So the AEP is what we call this. The annual election period is a period that runs from today, October 15th through December 7th. That's when anyone that has Medicare can make a change from one program to another. You can switch from a supplemental to a Part C plan or vice versa. You can do whatever it is that you want to do during the AEP, and there's no limits. Basically, the way it works is whatever application that you sign to join whatever program, you can even do that multiple times during this period. It'll be the last date, the last signature date that you've submitted in is the one that will end up going into effect for January 1st. Once January 1st hits, then we have a program called OEP. This is available to people who have made a change during AEP. It allows them to be able to have a look-see, if you want to think of it like that, and they can make another change if they're dissatisfied with the plan they've enrolled in, or they just want to go to something else, they can make that change during January 1st to March 31st.
So then after that, what, they get locked in, obviously, and they can't go anywhere?
Then you have to have a special election. That's called the SEP. And with the SEP, there's certain requirements that are going to exist. If somebody has Medicaid, for instance, that will grant them an SEP. If you move from New York to Florida, changing your address, moving to a different service area is going to allow you to have a special election period. So there's a number of them. There's some new ones this year for people that are having financial struggles. You know, you're always going to be able to know what those election periods are if you visit the Medicare website or you're talking to a professional and they're sitting down with you. I always think it's important to just tell people to just share what is it that you're looking for, what is it that you are thinking about. We can help you. We can direct you in the right direction, guide you.
Perfect. So now ultimately we talked about these periods. Now with the special election, I know that, you know, especially for the duals, or the ones that have Medicare and Medicaid. So there are some restrictions also that are added now more than ever, right? So I know that for a fact, for example, they have also some lock-in periods, and they can only make some moves from plan to plan within a particular time, right?
Once per quarter.
So once per quarter, and that's only for the first couple of quarters or 3 quarters?
Right, through the end of September.
Through the end of September. All right. Now, ultimately, someone that's aging in doesn't have to worry about all of this, right? They can pretty much enroll, correct?
Yeah, you have a 7-month window when you first are granted your right to have the Medicare card. Most people get that on the first day of your birth month when you turn 65. Some people get it because they're on a disability. Once you're on a disability for about 24 months, they'll grant you Medicare. And when you get your Medicare Part A and Part B, you have a 7-month window in which to enroll, 3 months before your birth month, the birth month, and 3 months after. And during that period of time, you can elect a Part C plan. You can sign up with a supplement. You can sign up for a Part D program, whatever it is that you want to do, and that will go into effect on the first day of your birth month.
All right. So in the interest of time, because we have about 8 minutes to go. Let's talk a little bit about your offerings, Centers Plan for Healthy Living. I mean, ultimately, there are different choices people may select from in every state, and you are ultimately working for a specific health plan, as opposed to a broker who probably presents multiple products and offerings. Let's talk about what are the offerings of Centers Plan for Healthy Living for 2021.
Okay. So I call myself a captured agent because I'm working for one specific company. We have 3 offerings for people that live in the community. One is called an MAPD, and it's the Centers Plan for Medicare Advantage. This is a program that has what we refer to as an enhanced Part B program, and it offers some nice incentives. So it covers your doctors, your hospital, the medicines. It covers, going for tests and blood work and all kinds of things like that. But what I like about the program is that it's a 0 premium plan, and it's a 0 copay to go and see your primary care. It's $30 to go to a specialist, which is a very reasonable price, I think, for seeing a specialist. And it offers some enhancements. It gives you a dental benefit, which is up to $2,000, covers dentures, covers a filling, covers cleaning, polishing, and bite wing x-rays twice a year. So it's really pretty much what you need for a drug plan and a dental plan. It's going to also give you vision care, $150 towards your glasses every year. I think that's a nice benefit. So in addition to our MAPD, we also offer what's called the D-SNP program, which is designed for people that are dually eligible, meaning that they have Medicare and that they also have either some level of Medicaid or the MSP program that we talked about before, which is the next level up from Medicaid. The MSP program, QIMB, QMB, SLIMB, SLMB, or QI. So if you have those programs, you're entitled to the D-SNP program, and that will allow you to have a cost share of between 0 and 20%, depending upon what your level is with the Medicaid or MSP program. So that becomes very reasonable. It's got an OTC benefit of $144. OTC stands for over the counter. So it allows you to actually get things that you would be buying off the shelf. Maybe it's, you know, vitamins or aspirin, but it could be things more expensive like, you know, women's incontinence program, you know, pads, things like that, which, you know, gets really costly. And it'll help you not have to spend money out of your pocket to be able to get those items. That's a great benefit to have. With our MAP program, which is the third plan, that stands for Medicaid Advantage Plus. This is a program that is relatively new, and it's designed for people that have Medicare, full Medicaid. You have to have full Medicaid, and then also a need for home care or long-term care services, things that would be happening in the home. You have to be in need of those kinds of service for at least 120 days. But once that program goes into effect, that's a good design because it's all care managed by you know, one entity, as opposed to an entity from Medicare, from Medicaid, and from long-term care services. So it consolidates and makes things very, very easy for a person.
Well, it does seem that you have a very good offering, and you know, you certainly broke it
I'm
down
very
very,
psyched. Yeah.
and you broke it down so simply that, you know, I got it. I mean, you know, I hope that everybody else, you know, can very easily, you know, understand it. Obviously, we're taking a little time. You'll probably do a lot more extensive, you know, description and explanation of all those benefits. And I know today was the #1 day for the season, so I wish you good luck and the whole team for that matter. But just a couple of notes before we close the show. So obviously this is also a compliance, you know, season. So, you know, just, you know, what would you say to all the agents out there about, you know, the practices that we should observe?
What would I say about it? I would say, you know, watch your P's and Q's. Definitely be sure to tell everybody everything. My philosophy has always been no sorry, grandma. I wouldn't want anybody misleading or doing something that wasn't right when they're working with somebody's mom or dad. I heard a horrible story today about an agent that was working with Medicaid who was just going through the phone book and writing up stuff for people that really didn't exist. You hate to hear stories like that. You hate to hear about people trying to, you know, do things wrong. You have to do things correctly and truthfully.
Do the right thing. That's so with that, that will be our final message for today. Again, we've tried to cover a lot of, you know, information in a very short amount of time, and ultimately we never can do justice to Medicare and all the different things and the different components and parts of it. You know, so certainly we might, you know, potentially have a different session where we can discuss a little bit more in details and maybe break it down, further. But Laura, thank you. That was a very impressive, great presentation there for those segments. Tiffany, Glennie, thank you so much, for the interactions and for the introduction of the program. I know I called on Tiffany first. Vlad, thank you for joining us. Again, from the iHealth channel, the iHealth radio, for me personally, Hurricane H, I want to thank everyone that's watching, listening, and of course our special guests for being with us and sharing their insights. Hopefully that everybody out there gets the most from this season. Learn the stuff that you need to learn. Educate yourselves if you have to. Those of you that are working in the industry, make sure you educate folks properly. Stay compliant, and let's get it done. Do it right. That being said, thank you very much, and we'll talk soon on our next show. Bye-bye.
Bye. Thank you.
Bye.
Yeah. Are you in your car?